अस्सलामुअलैकुम। मेरा नाम सानी है। मैं IMU का फर्स्ट ईयर का स्टूडेंट हूँ। आज हम जिस टॉपिक पे बात करने जा रहे हैं वो उस टॉपिक का नाम है द पोर्टल सिस्टम ऑफ द ह्यूमन बॉडी। तो द पोर्टल सिस्टम ऑफ द ह्यूमन बॉडी is an arrangement by which the blood is collected from the set of capillaries and pass on the large vesicles to the next set of capillaries before returning to the systemic circulation. ये होता पोर्टल सिस्टम। ठीक है ना। आगे हम बात करेंगे हाइपोफाइजियल और हाइपोथैलेमस पोर्टल सिस्टम। ये एक चीज़ ऐसे समझ लें कि ना ये ना माइक्रो सर्कुलेशन होती है ब्रेन के ना एंड बेसिक पे माइक्रो सर्कुलेशन होती है। तो इसका क्या नाम लेते हैं, ये ना कनेक्ट करता है हाइपोथैलेमस को तो पिट्यूटरी ग्लैंड को। तो इसका मेन फंक्शन जो होता है ना इनका मेन फंक्शन ये होता है कि ना ये उसको एक्यूट न्यूक्लियस ऑफ द हाइपोथैलेमस एंड एंटीरियर पिट्यूटरी ग्लैंड को ना आपस में इनके हार्मोन को ना ब्लड एक्सचेंज के थ्रू ना जल्दी ना ट्रांसपोर्ट करता है। ये इसका मेन फंक्शन होता है। ठीक है ना। आगे हम टीलेंसिफेलॉन से बात करें तो उसकी एक टर्म यूज़ होती है एप्रोसोडिया। इसकी डेफिनेशन ये होगी द इनएबिलिटी टू स्पीक और अंडरस्टैंड द इमोटिव कंटेंट ऑफ द स्पोकन लैंग्वेज। इस बात को अगर उर्दू में ट्रांसलेशन करें ना तो इसका मतलब होगा कि देर से बोलना, यानी कि उस इतनी रवानगी से नहीं उसे पेशेंट से बोला जाता, मतलब कि इतनी रवानगी से नहीं वो बोलता, भी अटक के बोलता है। तो ना शायद इसी में आ जाए तो अटक के बोलता है, मतलब देर से बोलता है। फिर अगला टर्म वर्ड डेफनेस, ये भी है ऑडिटरी वर्बल एग्नोसिया। ये भी प्योर नोन एज प्योर फॉर्म ऑफ डेफनेस वर्ड डेफनेस। इसमें क्या होता है, पेशेंट ना समझ सकता ना बोल सकता। मेरे ख्याल के मुताबिक अगर इसकी कोई वजह तो हियरिंग का प्रॉब्लम है, क्योंकि उसे सुना नहीं जाएगा तो बोला कैसे जाएगा। छोटे बच्चे होते हैं उन्हें सुनते हैं ज़बान तो उन्हें आ जाती है आहिस्ता आहिस्ता। उनको शायद कोई सुनने में कोई मसला होता है और उन्हें ना ज़बान समझ आती है, लैंग्वेज समझ आती है, कुछ भी फिर ऐसे ही रहते हैं, उन्हें कुछ समझ नहीं आता ना वो बोल सकते हैं। ये था आज का हमारा टॉपिक।
My name is Dr.M.Faisal and I am a first year medical student in OSH. Today I talk about the ganglions of the sympathetic nervous system. Basically, the three ganglions which give the innervation to the whole GIT, sympathetic innervation to the whole GIT: celiac ganglions, superior mesenteric and inferior mesenteric ganglions. And the celiac ganglion provides the innervation to the stomach, small pancreas, liver, gallbladder, and inferior mesenteric ganglion provide the innervation to the small intestine and the some part of ascending and transverse colon, which are part of large intestine. And the inferior mesenteric ganglion provide the innervation to the descending colon and sigmoid colon, rectum and anal canal. And the important plexus called the hypogastric plexus, which is the plexus which formed from the sacral outflow and provide the innervation to the sympathetic innervation to the urinary bladder and the male and female sexual organs, male penis and the in female uterus. These structures get innervation, sympathetic innervation from the hypogastric plexus. Thank you.
Assalamu alaikum. My name is Dr.M.Faisal and I am the first year student of OSH International Medical University. Today I am going to explain about sleep and wakefulness in Diencephalon and Jacksonian epileptic seizure in Telencephalon. First I will explain sleep and wakefulness. For wakefulness, reticular formation is responsible. We can say that it is a cerebral switch on off button. In sleep, we have some hypogenic states like thalamus, hypothalamus, and brainstem. There are few terminologies like somnolence. Excessive sleep is called somnolence, and inability to sleep is called insomnia. If we talk about narcolepsy, in narcolepsy there is uncontrolled desire of sleep and its duration is about few seconds to only 20 minutes. In cataplexy, there is uncontrolled outburst of emotions like anger. If we talk about the Jacksonian epileptic seizure, it is focal partial seizure or simple partial seizures. This means that the seizure is caused by the unusual electrical activity which affects only a small part of the brain. There is no loss of awareness and there is no loss of consciousness. Jacksonian epileptic seizure is also known as the Jacksonian march. And salivatory nuclei in medulla oblongata, where these may increase or decrease gastric secretions according to the.
Assalamu alaikum. My name is Tariq and I am a student in Osh International Medical University, Kyrgyzstan. Today I am going to explain the commissioner fibers, projecting fiber and associated fiber. First of all, I am going to explain the commissioner fiber. Commissioner fibers are also known as the commissioner track of the brain or the commissioner of the white matter that crosses the midline of the same cortical area in the opposite hemisphere, left and right hemisphere. Now I am going to explain the associated fibers. Associated fibers are known as the associated track or the intra-hemisphere track of the white matters that connects to different area of the same hemisphere. There are the two types of the associated fibers, which are long range and U-shaped fiber. Now I am going to explain the projecting fiber. Projecting fibers are also known as the projection track. In projection fibers, the cortex is connected with the other areas in the CNS. For example, the afferent fiber. For example, the deep nucleus, the cerebellum, and brainstem. They are the two types, efferent and afferent.
My name is Mohammad Usman Ali and I am the first year MBBS student of Osh International Medical University. Today I am going to explain a little bit about Telencephalon, praxia and visual agnosia. Praxia in frontal lobe there are B4, B6 and B8. B4 is the primary motor area, B6 is premotor area, B8 is frontal eye field. And if there is damage in B6, then there will be apraxia, which is inability of skill movements. If there are all the motor activities are damaged, then there will be contralateral motor paralysis, and all the motor activities are controlled by frontal lobe. And visual agnosia. Visual agnosia in occipital lobe, area 17, 18, 19 are present. Area 17 is a primary visual center, and area 18 and 19 are associated. And if there will be damage in area 18 and 19, then there will be visual agnosia, and if there is damage in area 17, then there will be contralateral amyopia with macular sparing. Assalamualaikum. My name is Mohammad Usman Ali. I am the first year MBBS student of Osh International Medical University. Today I am going to explain a little bit about Diencephalon. And my topic is precocious puberty and the hormone which is related to it. The precocious puberty mainly found in females. The precocious puberty age is 8 years, and in males precocious puberty age is 9 years. And the normal puberty age in female is 10 to 14 years of life, and the normal age in males is about 12 to 15 years of life. If there is penile lesion, then there will be precocious puberty, and the hormone melatonin, which cause precocious.
My name is Fahd Ahmad, and today is my third lecture, which is on the anterograde retrograde amnesia and as well as the Wernicke-Korsakoff syndrome. So, before really discussing about the anterograde and retrograde amnesia, we have to throw some light on the hippocampus and its activity and its function. So, the hippocampus function is this, that it helps in learning, and it has a major role, that is conversion of recent memories into long-term memories. So if there is a bilateral trauma, tumor infection, or any damage in the hippocampus, so it will lead to the anterograde amnesia. in which the patient will have the recent memory, but the patient will have the long-term memory, but he is unable to convert the present memory into long-term memories. Means that he is not able to seek anything and to learn anything and convert it into past memories. So after discussing we will discuss about Wernicke-Korsakoff syndromes. The Wernicke-Korsakoff syndrome is due to the excess amount of alcohol, which will lead to the deficiency of thymine B1. This will degenerate neurons at some certain places. These certain places or points are hippocampus damage, middle dorsal nucleus of thalamus, memory body, and the vernix of cerebellum. If there is a damage, trauma, tumor infection in the hippocampus, it will lead to dementia. And if there is a problem in vernix of the cerebellum, so there will be no balance in gait. The vernix of cerebellum damage will lead to the gait ataxia, antegrade retrograde amnesia, and the rumbar sign in which so in the gait ataxia the patient cannot move straight. When he start moving in a straight direction, he will lead towards different type of movements. For example, such type of movements in different directions and if moving in straight direction, he will not do in that straight direction. And in rumbar sign,
Assalamu alaikum. My name is Muhammad Humair Saeed and I am student of Ocean International Medical University. Today I am going to talk about Preynard syndrome due to pineal gland tumor. Preynard syndrome is known as midbrain autocolliculus syndrome. It is due to the lesions in rostral dorsal midbrain, which damage superior colliculi and pretectal structure. Patients with Preynard syndrome have difficulty in distant vision. They also report blurred vision.
Bismillahirrahmanirrahim. Assalamu alaikum. Today we will discuss about the Telencephalon. Basically, it is commonly called the cerebral hemisphere. The cerebral hemisphere, it is the largest part of the central nervous system, and it consists of the cerebral cortex, subcortical white matters like fibers, association fibers, projection fibers, and also there is the basal nuclei. Basically, Telencephalon, it is located above the Diencephalon in the forebrain, and today we will discuss about the two pathways due to which we have concept about the connection between the vernix area and the Broca's area through the arcuate fasciculus. And the first one pathway is that read a sentence and repeating it loudly. We read a sentence. We know that we hear visual from the eyes. So from the eyes we see a sentence and read from the optic nerve, and optic nerve after optic nerve the optic chiasma, then optic tract, and the fiber goes from the optic tract to the lateral geniculate body, from the lateral geniculate body to the sterietal area 17, and the sterietal area 17 to the angular gyrus area 39. After the area 39, the fiber goes to the vernix area, and the vernix area, which is connected to the Broca's area through the arcuate fasciculus. The fibers goes from the vernix area to the Broca's area through the arcuate fasciculus. When from the Broca's area, the fiber goes to the Brodmann area B4, which is primary motor area, and from the primary motor area the fibers goes to the medulla, and after medulla goes to the larynx, and then we repeat it loudly. And the second one pathway is that hearing a question and answering. So first we know that we hear from the ears, and then after that the nerve, then track, then at the end medial geniculate body. After the medial geniculate body, at the end there is the central area, which is 41 and 42. After the 42, the fiber goes to the area 22, and from the area 22, the fibers goes to the vernix area, which is connected to the bronchus area through the arcuate fasciculus. The fibers goes from the arcuate. Bismillah Rahman Rahim. Today we will discuss about the Diencephalon. Diencephalon, it is located below the Telencephalon and above the midbrain. There is the hypothalamic sulcus, which divides the Diencephalon into two parts, interior part and posterior part. Interior part is called pars ventralis and the posterior part is called pars dorsalis. The pars ventralis consist of the hypothalamus and subthalamus. Pars dorsalis consist of the thalamus, epithalamus and metathalamus. Today we will discuss about the thalamus. Thalamus, it makes the 80% of diencephalon. It is the egg-shaped mass of the grey matter, and it is the Greek word named as the inner chamber. There is some nuclei in the thalamus which are called thalamic nuclei. There are like anterior nucleus, interlaminar nucleus, anterior nucleus, ventrolateral nucleus, medial nucleus, ventroposterolateral nucleus, pulvinar nucleus, and the last one is mediodorsal nucleus. Today we will discuss the input and the output of the thalamic nuclei. The first one is anterior nucleus. The input of the anterior nucleus is from the cingulate gyrus and the mammillary body, and the output of the anterior nucleus is the cingulate gyrus through the internal capsule. And the second one is internal laminar nucleus. Internal laminar nucleus, the gets inputs from the reticular formation. Reticular formation, as we know, that the switch which on or off the central nervous system. And the second one is spinal thalamus, and the output of the interlaminar nucleus is to the cingulate gyrus. And the third one is ventro-anterior nucleus. The input of the ventro-anterior nucleus from the globus pallidus and the substantia nigra of midbrain, and the output of the ventro-anterior nucleus is to the Brodmann area 4-6 primary motor area. Basically, ventro-anterior nucleus and ventrolateral nucleus are also called the motor nucleus because they help in motor functioning of the body. And the next one is lateral nucleus. Ventrolateral nucleus, it gets the input fibers from the globus pallidus and the dentate nucleus of cerebellum, and the output of the ventrolateral nucleus is to the Brodmann area only 4. And the next one is ventropostro. The next one is ventropostro-medial nucleus, which gets the input fiber.
Bismillahirrahmanirrahim. My name is Saudamir. I am first year medical student studying in Osh International Medical University. I am here to tell you about the Klein-Levin syndrome. Klein-Levin syndrome is a type of frequent hypersomnia. People with Klein-Levin syndrome experience they are sleeping more, like 20 hours in a day from last few days, and this disease will occur many times in a year. And in this disease, person becomes so lazy, and the person or patient like to sleep more, like multiple times. They want to sleep every time in a day. That was the topic. Thank you.